So our next session is just on that topic, because I think one of the things we've learned, obviously this is very much a European focused session, and what I'm looking to do now is to look outside of Europe, without pressing any slides, and think about what opportunities are there to engage with our ecosystems, either in the US, and I was hoping to bring in colleagues from our ecosystem colleagues from Africa. Unfortunately, they got COVID, so they can't go. However, not to be outdone, I've asked colleagues from the UK to come along and also talk about what opportunities there are to collaborate within the UK as well. So, John, Amy, if you'd like to come up, please. So, no, Amy's behind you.
Okay, good.
So, we were going to hear from Africa, but we're not. We're going to hear from John. Let me just double check.
Do you want to try it?
Yeah, that's good. Good. So given we've got a very small audience, I'm going to keep my remarks to a couple of things, and we don't even need to run through slides at this point. I want to just pick up some of the comments we've heard in prior presentations about the US. So despite this accent, I live in California, and I've been there for 20 years. So I'm in the US healthcare marketplace. In scale terms, one of the reasons you hear that the US is such an important player in the global ecosystem is that not only do we spend so much money today, we're about to spend a lot more. So to give that some quantification, we're spending $4.6 trillion on healthcare alone in the US right now, this year. $4.6 trillion. These are giant numbers we can't even imagine in our head if we were to try to do it. Even imagining $1 million is a lot. If you were to try and count that pile of money, it would take you 12 days to count $1 million alone. 147 years to go and count $1 billion. So 4.6 trillion. Even worse, that number is going to double by 2035. We're going to spend $10.3 trillion. So that's bigger than the Belgian economy, which is about $500 billion, the Dutch economy about $1 trillion, the German economy about $4 trillion, the British economy about $3 trillion. So these are giant amounts of money. The US government underwrites all of that and is happy to spend that money. But essentially what it wants to do is two things, and just take this away as two things I think that can guide you. I think when innovation, they are very interested in innovation from around the world. There is just not enough of it in the US alone. So everyone who was up on that last panel talking should feel very good about the fact there is investment opportunity in the state. It's why it's such a good investment market. And you heard it here, we're awash with capital, but we can't deploy it. And very often we can't deploy it because there isn't a path to ROI on it. So it's not just input without having that ROI argument. So when you're guiding startups at any stage, particularly at pre-seed, seed, early stage, in terms of rounds of capital, make sure they've really got a solid argument in terms of what that ROI path looks like, because the US government doesn't care whether it comes from Lithuania or Germany or Belgium or beyond it, in Israel, Africa, and all the places we've heard about. And it wants it in all sectors. Because it knows it's on a path to spend that money. By the way, that money is pretty much all spent on sick care. 98.5% of our spending is people getting ill and trying to get them back to some kind of equilibrium. It's not about prevention. It's not about wellness. We spend tiny, tiny amounts of money on that. So again, if your startup is about prevention more than it is about just getting people back to equilibrium, so much the better. This is the one part of the US that people underestimate. So get that message across is sort of number two. One of the things we did, I can go to the next slide, Andy, if we could, and I'm just going to talk through why we did this, is in Vive in February, in Los Angeles it so happened, we launched a thematic innovation ecosystem, our latest one, the 15th, I think, on healthy aging. And this is a very busy chart, but it suggests, one of the reasons we launched it is we think this is one of probably the greatest challenge of healthcare, partly because of what I said around prevention. This is healthy aging isn't about just getting sick people better. It's about getting people to take healthy aging seriously through every stage of their life. So from relative youth, babies and children, all the way through to what we think of with healthy aging, which is older age. But we've got to think about it in terms of friction points and drivers. And it's not just the stuff on the right-hand side we have to think about, the driver side, we have to think about friction. One of the reasons that we've got a sick care system in the US, for example, is because we've got lots of friction that keeps it that way. The biggest of which is just people get paid for people being sick. We have a reimbursement system in the US that needs to change. Again, we need innovation to make that happen. So go to the next slide, Andy, just in the interest of time. And I think the pillars in terms of how we do that are just represented on this house, temple, whatever you want to call it. I think it's actually looking things that are contextually critical in terms of thinking about health. Health is an outcome of many things that underpin it. So, and they're on all the columns written on here. And I think perhaps most importantly, it sits on really good data. We have really bad data in healthcare. We have unclean data. We have missing data. We're missing huge swathes of data around social determinants. We need to fix that so that we can actually understand how we can get to a wellness-orientated culture. It's going to come out of things like genetics. It's going to come out of understanding social determinants and weaving them into electronic medical record systems, not just the fact that you had an injury or you were sick some years ago. It's not enough to go and predict that someone's going to stay well for as long as they can. This whole idea of health span at the top of the chart. Go to the next one. Go to one more if you wouldn't mind, Andy, and go back to this. What I'd like to see in terms of healthy aging is we put this ecosystem together and we invite everyone to join this, because if it's one of the great challenges of our time, almost as big as something like climate change, we need to really put our effort into this. So the more diverse the group we have in this thematic ecosystem, the better it is. But I think what we'd like to see is information on every one of us sitting in this room that looks like what's on this chart, not just on this left-hand side as you look at it, where we might know someone's age, or we might know that they have a mental health issue, or they're taking SSRIs, or they're of a certain weight. This is basic information. We know this today. What we don't know is everything on the right. And yet that data is out there. So if we can find ways to combine it together and produce a chart that looks like this, we can start getting a clue about what makes that person thrive in the future. So you'll see just as one data point on here, this person's got 3 children. One of those children is autistic. One of those children is in a prison system. Do you think that has an impact on their health? I think it does. So we need to think about how connected the social side of life is as much as the healthcare side of life. And charts like this are an outcome of data that already exists in the world. The future is here. It's just unevenly distributed. But we need to connect it now. So I think that's the greatest challenge. So, and go to this last one. So this ecosystem is going to focus broadly in these areas, but this is just a working model in terms of the subjects we'd like to invite people to talk about. As you heard Andy say earlier, we will be inviting people from other ecosystems, companies of all stripes to come to this and talk about making change. So if you're interested in getting involved with that, please contact me. I'm an ambassador in the US, one of 2 ambassadors in the States in California. We can talk more about the US ecosystems or talk to Andy. Thank you.
Thanks for that, John. And I think an invitation there for people to get involved with the healthy aging ecosystem and also explore some of John's connectivity because, as he said, we've got a number of ecosystems within the US to connect you to as well that have the same connectivity we talked about before and shown before with our colleagues here. And certainly then with John and Nicole, our ambassadors there, really good on-the-ground networks and connections for not just yourselves as ecosystems and companies, but also your members and colleagues too. But what I would be amiss if I didn't bring on our last speaker, because the voice we've not heard of today is from the UK. And the UK is where we set up certainly our first ecosystems way back over 14 years ago. And we're very pleased that we've got not just one of them, but the outstanding ecosystem from the Yorkshire and Humber region with Amy, under no pressure at all. to talk about some of what level. Tell us a little bit. Give us a picture about that ecosystem in Yorkshire and Humber.
No problem. So, hello, I'm Amy Lochte. So, I'm the Innovation Hub Director for West Yorkshire, and my role sits jointly between our Integrated Care Board and a Health Innovation Network, which probably means nothing to anyone in this room. But to give you some context, in England, the NHS has 42 Integrated Care Boards, and they cover populations of a couple of million. So the West Yorkshire Integrated Care Board covers about 2.4 million people. And the Health Innovation Networks are a network of 15 innovation specialist services that are commissioned by the NHS to help drive innovation into our system. And what we've done quite uniquely in West Yorkshire and across the Yorkshire and Humber region is embed health innovation staff into the NHS Integrated Care Board to really get an understanding of our systems, to think about how do we drive this change, how do we make innovation culture a standard, not a nice to do, and you know, we're not going to get anywhere in the future if innovation is not fundamentally driving what we do. We have to take that step change. So a couple of things from a Yorkshire and Humber perspective that I think lead on from some of your points is data is, you know, we serve 66-ish million people in the NHS every year. You know, that's our UK-wide population. And if we're just looking in kind of the Yorkshire and Humber region, we're looking at about 5.7 million, which is bigger than Scotland, just in one county. So we're pretty big. It's vastly different in terms of demographics, ethnicity, poverty, health inequalities, health equity. You know, there is a mile-long road in Bradford, which is a place in West Yorkshire, and there is a 10-year life expectancy gap from one end to the other, depending on your postcode, so depending on where you live and what access you have. And that drives to the social determinants we were just talking about. But one of the things that we've done and we've realised is data is our biggest asset in Yorkshire. And we have something called the Yorkshire and Humber Care Record, where all of your data is. And then to build on that even further, there is an initiative and a research initiative, and we are extremely fortunate in Yorkshire and Humber that we have incredible universities, incredible research and development departments, but we have something called Born in Bradford, and that was a research project that it recruited young mums, pregnant mums, to have their children signed up to this research project. And that set of data is linked to schools, social care, police, local authorities, not just your health. So we got this incredible picture of patients, which then meant that we're able to model, which then means we're able to think about how we deliver our services in the future. So absolutely, how we model our data is absolutely essential. And I think it's something that not just in West Yorkshire that we're focusing on in the Yorkshire and Humber region, but as a UK as in itself, you know, we've just commissioned Palantir to do our federated data platform. We have secure data environments, which is looking at how to cleanse that data, do large data sets. So researchers, industry can use that to really think about how they develop innovations and new drugs. And then on top of that, you know, especially in West Yorkshire, we're thinking about, okay, so how do we go one step further from a secure data environment? How do we then utilize this data to develop digital twins so that we can replicate human beings and help innovators with gathering, you know, clinical evidence on a simulated person, and then think about, okay, so when we throw in an AI model in there, how can we model what's going to happen? How can we predict, you know, the weather's going to be bad in 10 days' time, so we're going to have an increase of neck of femur fractures, so we're going to need X many orthopedic beds, and be not only a better reactive healthcare service, but also that preventative healthcare service. So there's a lot going on in Yorkshire, and that's just in our little neck of the woods. And that's without going, I mean, I literally think I had about an hour and a half to prepare to come up here today. So I have scribbled thousands of notes. And even just looking at kind of the economy and where digital sits within that, you know, we're looking at 58 million just in the Yorkshire and Humber region alone, going into the UK economy from digital health tech. We have a third of all UK digital health jobs sit in Leeds. You know, we are the biggest centre for this outside of London, and we're an hour and a half on the train, and it's to be fair, a pretty good train that doesn't get cancelled very often, which if anyone has ever been to the UK, that's a novelty. So, you know, we're we're open. We've got fantastic research and development places. We have things like Nexus up in Leeds, which is an incubator that takes SMEs all the way through. But we also have big, multinational corporations sitting in our ecosystem as well. So we all, we're really well connected, but we've also got an NHS that is desperate for innovators to come in and work in partnership, understand our problems, and think about it as a whole. So we're not just going, oh, this is a nice shiny piece of tech, it's a new robot, let's throw this in. No, actually, where are you going to put it in? What does the pathway look like? What are the determinants when you put it into a pathway? And that's kind of what my job is to determine how do we take a really good idea, put it into a pathway, can make that sustainable, and then think about spread and scaling that across the rest of the country.
And not just across the rest of the country, because what AIM is, again, shy like our previous ecosystems, is that Yorkshire and Humber don't just do this in the UK, they also get involved with trade missions in Scandinavia, with Oulu, with the ecosystem we were before, with the other Scandinavian ecosystems. They're quite a rarity within the UK, because a lot of people thought, okay, UK, Brexit, it's going to be a bit difficult, and they're still probably whinging, but not in Yorkshire and Humber. They still get it, and still get the value of trade, which I've seen time and time again. I think certainly in Leeds, I always used to refer to Leeds as the People's Democratic Republic of Leeds, because it's slightly different than the rest of Yorkshire. So even within Leeds, you've got this fantastic connectivity, digital,
Yeah,
built in.
absolutely. And frustratingly, my boss is also here today, but he's actually presenting in another thing, so can't hear me bigging up his program, which is frustrating, so I'm not going to get the brownie points. But we have something called Propel at Yorkshire and Humber, and that is a digital accelerator. So we bring new innovators in, we give them a crash course over 6 months of how to do this in the NHS and do this well. But not only do we do that for our UK-based SMEs, we have corridors, like you say, to the Nordics, but we also have it in the US. So we have done things with Texas. We've done things with, Florida, Miami, I think. So we've had, we've got those corridors, and, we're really keen to build those up more. We've got one with Canada coming up in a couple of weeks' time. So it's not just about how we can import really good technology from abroad, but it's also actually we've got some great technology and, stuff that the NHS maybe either isn't ready for, or we just haven't quite got the right pathway that is perfect for the US. So how do we help that? So we don't see that as a bad thing, because ultimately we're thinking about that inclusive economic growth within our region. If you're bringing in money into our economy, that means better services for our patients and public, which means a better standard of living, better access to healthcare, which then goes into all of your social determinants. So then you're having healthier populations by investing into that inclusive economic growth piece as well. So for us, we see the full picture, not just the bit of technology that's coming into a healthcare system. It's so much bigger than that.
And the other thing that's happening in Yorkshire and Humber, which is fantastic, is across then the north of England. So I think it was about a week or two ago, I was at an event which brought together not just Yorkshire and Humber, but Greater Manchester, the northwest coast of England, including Merseyside, Cheshire, Cumbria, in a way that hasn't previously happened, because they realise, as a region, to be able to match the size and scale of London, that collaboration is essential. So it's built in the north in ways that we don't see across the rest of the UK. So if you want to get hooked up in the UK, you need to speak to Amy or any of her colleagues out here, including Richard as well, one of our UK ecosystems. If you want to target the US or indeed the healthy aging thematic ecosystem, you need to have a chat with John following up from today, because John's background in this is long and been involved with this for many years with Silver Moonshots previously before, but a long-term player in this healthy aging thing. If you're interested in our follow-up sessions, so we've got a question, from Monse at the back. You have to shout, Monse, I know you're quiet. Come on, let's have you.
No, but I can project. So I have a question for John, or a question and a suggestion actually. So my question is, when you showed the determinants, the positive and negative determinants for healthy aging, I was thinking on the social progress index.
Yeah.
This matches quite well. Have you worked it out a little bit, or?
Yes, and in fact, there's a number of models that are in development as we speak, and I think one of the things to do is to try and simplify all of that and get agreement on what it is we're trying to measure, and then what's its priority order. I know insurance companies now, for example, are using as many as 800 predictive elements in terms of people's capacity to thrive. 800 is just too many, and they don't rank order it. I mean, they try and do it for actuarial purposes, for risk calculation, but I think we need to use it all the way across the health system and start to weave it into the fabric. So I think there's collaboration opportunity to talk about what we deem to work well and take the best of each of those so we can bring it into one model.
Exactly, because besides this like 13 years of, you know, you have the follow-up of what happens in those 170 countries, something like that. And the other thing is, I mean, what we do is connecting. Probably you know about that, but in Europe, I don't know if, probably for recording, but not for listening. No? In Europe, there's one ecosystem north of France with this in Lille area, Aura Santé. It's quite strong in healthy aging. So, I mean, we're partners. I guess you are too, but happy to connect. That's what we do here.
That's great. Let's do that. Thank you.
Okay.
And there are many ecosystems that have healthy aging baked in to their priorities, whether that's in Eurosante in Lille, or in Cluster Civi in Spain, or in Scotland, or in every single ecosystem's got that area of interest. And if you're wanting to find out more, again, we can connect you. Last thing I'll say on that is that we also do every month a feature on our ecosystems, which took a decision process over 15 years to get to the exciting title of Ecosystem of the Month. The decisions took ages, but that's a great deep dive in our ecosystems, whether it's the ecosystem in Yorkshire and Humber that have been Ecosystem of the Month previously, or in Oulu, or in Transylvania as well, but and hopefully soon Lithuania. Bledin, you've got a question.
Well, so a question just to follow on from the last exchange. Okay, so there's two things just for people to interest them. One is YouTube and Google Health, who are on the main floor, are using the phrase information as a determinant of health, which is really interesting, okay? And those of you here a little earlier, I was talking about how fundamental digital literacy is and health literacy is to doing anything around prevention and well-being. And the answer's not with health systems, the answer's with people and changing people's perception. And we have to do that. We have to deal with health literacy. So watch this space for around Google and YouTube, I think. And then we have a project that I think we'll tender for around what is loosely being called smart data, social data. So information about people that isn't the traditional source for healthcare systems. So anybody who's is doing anything interesting in that area, we're definitely interested in that in the next couple of weeks, because we'll be working out whether we're going to tender for it or not. So we're looking for partners to some extent. So very interested to meet anybody who thinks they've got something to offer there. Thank you.
And just to come in on that point, that was louder than I thought it was going to be. The digital equity, digital inclusion, it's a huge problem. So we know that the digital divide truly exists. We know that kind of information, the health literacy, we are seeing, a cost of living crisis that's never been seen before, to the point where, I think there was something like 1 in 8 people were getting rid of their broadband because they couldn't afford it. So when we're more and more moving to that digital world, we need to, yes, be a digital first, but not a digital only health and social care kind of service. And that's for multiple reasons, not only because of the literacy, not only from a health literacy, but a digital literacy point of view, but also because people don't have access to fast, secure, confidential data sources. We have people sitting in McDonald's doing a doctor's appointment via a video thing because they can't afford internet at home. That's not conducive to anyone's good health. So I think If we're also thinking about information being a source of determinant, which I absolutely agree with, it absolutely is, we need to make sure that the conditions are there so that everyone has access to data, everyone has access to devices, if that is the world that we're more and more moving to. So there's also a responsibility on us as innovators, as healthcare systems, to think about that, think about, yes, digital first, but not digital only, and how do we support people to be digitally enabled so that we're not widening inequalities with what we're doing.
And there's a telling image during the pandemic, or during the end of the pandemic, of kids sat outside a McDonald's on their laptops, looking naughty, okay? That sort of naughty, thuggy-looking child might come and rob they must be there to rob cars. They weren't. They were there leeching the Wi-Fi from McDonald's so they could do their homework, because they had no connectivity at home. And that was a message that was biting in terms of what Amy's trying to say. And that's the case in the US as much as the UK, and I'm sure it's in other countries too. The other thing I'll flag up as well, we've got one of our members, Hello Car, we've got a dementia-friendly operating system on a phone. So I think there's a way of which we've got some of our providers here who might be interested in taking part in that ecosystem, but also connecting up with our members.